Hello, my name is Alexa Kwachak. I'm in Sports Medicine 3, and for my fourth project, I did medical journal research, and for my topic, I chose Ankylosing spondylitis. For the medical journals that I interpreted and analyzed, I mainly used the article in the center, which came from the BMJ, British Medical Journal. The BMJ is ranked fourth best medical journal resource in the world. It is peer reviewed weekly and one of the oldest general medical journals. As well, I used the one on the left, from the British Society for Rheumatology, as well as one on the right, created by the Europe PubMed Central, Europe PMC. For the table of contents, first I will describe ankylosing spondylitis and answer basically what it is and just the basic information. Next, I will answer what the causes are for this autoimmune disease. Then I will discuss HLA-B27, what it is and how it is related to this disease. Next, I will talk about the symptoms and effects of this autoimmune disease, and then I will discuss the related health conditions. And lastly, I will talk about the treatments for ankylosing spondylitis and if there is a cure. So, ankylosing spondylitis, also known as Behçet's disease, is a chronic inflammatory disease as well as an autoimmune type arthritis. So, joint inflammation, swelling, and tenderness. An autoimmune disease is when the body attacks its healthy tissues, and this autoimmune disease affects the spine and large joint areas, so the facet joints of the spine, and can also affect the joints of the shoulder and knee. It also affects site attachment areas where muscles, tendons, and ligaments attach to bone, and causes fusing of the vertebrae. So I broke down the words of this autoimmune disease. So ankylosis means fused bones. The fusing of bones or hard tissue. Spondylo refers to the spine and vertebrae, and itis refers to inflammation. And over here on the right, you can see images. This spine on the left is an image of a regular spine. The one in the center, you can see there is much inflammation in the spine. And on the far right, you can see a case of advanced ankylosing spondylitis, where there's actually fusing of the vertebrae. So, as of right now, there are no specific known causes for ankylosing spondylitis, but genetic factors have seemed to play a major role in this disease, and specifically the HLA-B27 gene, which I will talk about next. And here on the right, you can see another image of a spine, and in image A, you can see that there is fusing of the vertebrae once again. So for HLA-B27, or human leukocyte antigen B27, this is a gene, and when you test positive for it means that there's protein located on the surface of white blood cells, and a positive blood test suggests greater than average risk for developing autoimmune disorders like ankylosing spondylitis. And although there is no clear explanation in regards to the cause for AS, it is believed to have some association to the HLA-B27 gene. And 80 to 90% of individuals with AS actually test positive for this gene. Risk factors of ankylosing spondylitis. So, According to one of the medical journals that I analyzed, the main author was Dr. J. Seiper. Men are afflicted with ankylosing spondylitis approximately 2 to 3 times more frequently than women. So you can see that up here. And then the overall prevalence in the population has been reported to be as high as 1.9%. And then for ages, people usually develop this autoimmune disease in the second or third decade of life, and 90% of those diagnosed are between the ages of 15 and 40. For the symptoms of ankylosing spondylitis, back pain, stooped posture, early morning stiffness or stiffness during periods of inactivity, and trouble with or inability to take deep breaths, appetite and weight loss, fatigue, fever, anemia, which is a lack of blood, joint pain, pain at the site of muscles, ligaments, tendons to bone, organ damage including heart, lung, and eyes, eye pain including redness and light sensitivity, and vague pain in the glutes, thighs, heels, or near shoulder areas. And so you can see here on the right 5 early warning signs of ankylosing spondylitis. For the effects and complications of AS, spinal fractures are huge and very important. They can potentially harm the spinal cord and nerves passing through the spine, which is very dangerous and can be pretty debilitating. So, cervical spine fractures are most susceptible within this autoimmune disease and can lead to paralysis resulting in partial or total loss of use of limbs and torso, and then eye inflammation, as well as spondylitis, which is spinal infection, as well as heart complications, including aortic insufficiency and cardiac conduction disturbances. And next, so the Bath Ankylosing Spondylitis Functional Index, or BASFI, is a self-assessment test, and the higher the score, the greater the performance impairment of those diagnosed with AS. This assessment evaluates function of the patients with daily activities and situations, and testing results showed significant patient improvement after 3 weeks of inpatient treatment. So this was done in a study. They had a sample of patients take the test before, and then they were included in inpatient treatment, and then 3 weeks later tested again, and significant improvements were shown. And on the right you can see these are the exact questions and situations described within the test. And some related health conditions to ankylosing spondylitis include psoriasis, which is a skin disorder, skin cell buildup, and this is shown through like itchy and dry skin and patches of dry skin. And then fibromyalgia, muscle pain, tenderness, and fatigue. Also inflammatory bowel disease, which is inflammation of the digestive tract and system. Enthesis, which is inflammation at the sites in which the tendons and ligaments insert in the bone, as well as peripheral arthritis, which is arthritis of large joints of the arms and legs, including elbows, wrists, legs, knees, and ankles. As for the treatments for AS, there isn't a specific cure, and the major treatment for AS includes medications like anti-inflammatory medications. As you can see here, as well as tumor necrosis factor blockers, TNF. Um, and all of these medications help with pain and inflammation. And then physical therapy and surgery is pretty rare, but there are some occurrences with severe pain or joint damage, especially in the hip region. And then a laminectomy relieves pressure on nerve roots, which is a type of surgery that can be performed if needed. And then some other daily and at-home treatments include exercising and staying active, because this disease does get more painful and worse with less activity and exercise, as well as applying heat and cold to help with inflammation as well as pain, and then implementing and practicing good posture. Thank you for watching. Any questions?